Hi guys, and welcome to my channel. My name is Kachi, and today we'll be talking about something very important. And if this is your first time watching me, you're highly welcome. And for those that have watched my videos before, kindly subscribe, like this video, and yet turn on the notification bell because I'll be bringing in goodies, info here and there. I'll be bringing vlogs and a whole lot of other beautiful things. Now, you want to be part of my family, yeah, the Kachi Lifestyle family. So please subscribe, like, and comment. So let's get into the business of today. So today I want to talk about epilepsy, but when I'm going into the medical details of it, I want to really talk about how you can care for an epileptic person. Epilepsy is a disorder of the brain characterized by seizures. You know, seizures is when you're having a fit. We're going to be talking about how to take care of someone that's having a seizure. We want to break the myth that's associated with these seizures with epileptic people, the causes of this epilepsy, how you can prevent it, you know, how you can treat it, how you can assist someone who is epileptic, how you can, you know, maybe you have a relative, a friend, or whoever is epileptic around you. You really want to watch this video. Now, even if you don't have anybody around you, you want to watch so that you can be able to help a stranger on the road, you know, kind of like give them first aid, you know, assistance, be the good Samaritan, and actually know what to do, because a lot of people don't know what they're doing. I came across a set of people. This woman, she was on a bike with, I think it's her son. She was, the son was between the mother and the bike man, and he started having a seizure on the bike. So the woman brought him down and then started hitting his head. You know, he started hitting and the boy said, back, back, back. And I'm like, I was driving, so I stopped one down. I was like, madam, stop hitting his head. And then she stopped and then went on to, you know, hold the child like this very well. Sit there. I'm going to tell you things you shouldn't do. There are a lot of things you shouldn't do. There are a lot of things that you're doing for people that are having seizure that is causing more harm than good. And seizure is not only peculiar to epileptic people. There are a lot of other things that could make someone have seizure. So you want to watch so that you know what to do exactly. Now, like I said before, epilepsy is a disorder of the brain, and the main feature of epilepsy is seizure. Now, when you have seizure 2 times or more, then you can be diagnosed as someone that has epilepsy. How do they diagnose this epilepsy? When you're having seizure, they'll put you on a CT scan or MRI, and then they'll check the activity of the brain. Then they'll be like, okay, this person has epilepsy or this person doesn't have epilepsy. Now, there are types of epilepsy, and after the types, we're going to talk about the causes. Now, the types, we have 2 types, 2 main types. The first one is generalized seizure, and then the other one is what we call focal seizure. The generalized seizure is the one where you have the absent seizure, which is a petit mal, or the grand mal seizure. Now, the absent seizure is usually mild. This is where you see somebody, the person might be talking, and all of a sudden the person just stops talking and the person is staring, or like the person is in a trance. And now the person is just staring like this. Or the person is walking and all of a sudden the person just stops, and maybe think what the person is holding falls down and the person is just staring. Okay, now this lasts for like 1 to 2 seconds. The person will get back themselves and continue whatever they are doing. So I'm going to tell you how you want to help this person that's having this type of seizure after talking about the types. Now let's go to the grand mal. The grand mal seizure is on a larger scale, kind of like the person cries out, you know, loses consciousness, falls to the ground, and starts jerking. So now this is what we all know as epilepsy. You know, most people don't know about the absent seizures. What they know is this one I've just talked about, where the person falls to the ground and is, you know, jerking. Now I'm going to also tell you how to care for this person and what you shouldn't do for someone going through this condition. The other type of seizure is what we call focal seizure. This is where a part of the brain is affected, and then it makes the person have either a simple seizure, that is a part of the person will just be seizing, or a complex seizure. Now, this one is when the person could make the person become confused or dazed, and they won't be able to answer your questions properly. Whereas the secondary generalized seizure is when the seizure starts from one part of the brain and then progresses to the other part of the brain, and then still presents like a grand mal, but is a focal seizure. Now let's go into the causes. Now there are different causes. After these causes, we're going to talk about how you care for these types of seizure. So there are different causes. The first cause is trauma to the brain. Now, this is the one of the common causes of epilepsy. Where you have trauma to the brain, it could be as a result of road traffic accident, domestic violence, when a spouse hits the other person with something hard on their head, or anything that would cause injury to the brain could cause epilepsy. Now we have stroke. Stroke could also cause epilepsy. There are other things like infections, infections going to the brain and causing epilepsy. Also, brain tumor, and a whole lot of anything that affects the brain literally could cause epilepsy. One of the causes that is very, very common is idiopathic cause. There is no cause. There is no cause. The epilepsy just started on its own. There's no reason. It just started. This one is more common. Most people that have epilepsy, there wasn't any reason or anything that caused it, like trauma to the brain or infection or something like that. It just started on its own. That is one major cause of epilepsy. It just starts on its own. Now, let's talk about how you want to, take care of this person. The first thing, for someone having absent seizure, that is when the person is just staring at you. You don't want to go shaking this person. Like, hey, talk, what are you doing? No, like you just want to allow this person, allow it to elapse, because this lasts for 1 to 2 seconds. Some people don't even notice it, but some people notice it. If the person is your friend, you will notice that once in a while they just stand and they look like they're in a trance or they've forgotten something. Yeah, so if you have a friend or relative that is suffering from something like this, you just want to wait it out. And then when you wait it out, you also want to assist them by telling them where they stopped in the discussion. It'd be like, okay, you were saying this or that, okay? And then they continue whatever they were saying or whatever they were doing. For the grand mal, what you want to do is, if you're close to the person while the person is falling down, you want to catch this person and gently lay them on the floor. And then when you lay them on the floor, please don't lay them on the back like this. You want to lay them up to the side so that their tongue don't fall back when they're like this, and it will prevent them from breathing. So you lay them by the side so that their tongue is out, they're breathing, and they can also salivate properly. Another thing you want to do is, if they have tie on, loosen the tie, loosen their belt, okay, anything that is constricting, you want to loosen it so that they can freely breathe, and be comfortable. Then you can also, while you're lying them like this, you can put what do you call that thing? You could put maybe a jacket or a scarf under them. Don't put something big, very high, just something flat like that under them so that you protect their face, because they could also be, scraping their face on the ground. So you want to put something to protect the face. Now, you don't want to restrict their movement like what that woman was doing. Don't restrict their movement, okay? You allow them to jerk till it's fit is over, okay? Don't hold them or restrict them. No, you don't want to do that. Then you don't also want to be pouring things on them. Pour water, pour oil, pour this, pour that. I know we're religious in Nigeria. A lot of people bring holy water or anointing oil to kind of like see. Epilepsy is medical, okay? It's not an evil spirit at that moment that is doing that thing. It's medical. So just allow it to, to do its process, and it will stop. Okay, so don't pour this, pour that, but even if you have faith and you want to do, just gently rub it on them, or sprinkle it small. Don't pour. I see people drenching them with oil, drenching them with water and all of that. It's not. Don't do that. They didn't faint. You're not trying to shock them back to reality, or like hitting their head. Don't even try it, because hitting their head, you're causing more trauma to the head. So it's not people that fainted that you want to shock back to reality. Don't do all of those. Then another thing you want to do is, after this person have gone through this seizure process and they are back to themselves, you want to allow them to really rest. And some people, once they go through the seizure, they sleep. Then when they wake up, they're fine. But if you're outside, because of the environment is not conducive, they may not sleep. So you want to allow their brain to calm down and then remember. Then when they come back, you'll be like, okay, we were walking towards this place and you were doing this, and you came out from here. Where are you going to? As a good Samaritan, you can assist them to where they're going to, or do 1 or 2 things. Now, you also want to protect their belongings. When you're around them, please. There are a lot of people that see people in problems and still go to steal from them. Hold their bags, hold their shoes, protect their belongings, so that when they come to, they can actually continue what they're doing. Now, some epileptic people actually soil themselves when they are having a fit. So You can help them, direct them to somewhere, a toilet where they can clean up and stuff like that. Another thing you don't want to do is to put your hand in their mouth or to put a stick or a spoon into their mouth. Please don't put anything into their mouth. Don't put anything into their mouth. If you go and put your hand in their mouth, they are going to bite it off. Okay, they don't really bite it off, but they can clamp down on your teeth and you cannot open it. Okay, it's difficult. So don't put anything into their mouth. Aside from the danger to you, it's also harmful to them, because while you're forcing that spoon into their mouth, a lot of people bring iron spoon and they're forcing it to open their teeth. Oh, the teeth, no. So allow them. Don't put anything into their mouth. Spoon, stick, spatula, anything, don't put into their mouth, or your fingers, don't put your fingers in their mouth. Now, another thing you also don't want to do is to be putting substances into their mouth, pouring water in their mouth, putting oil into their mouth, because they are kind of like unconscious, because they could choke. It could go into the trachea instead of esophagus. It could go into the lungs instead of going to the stomach. So don't put anything into an unconscious person's mouth. So these are the things you want to do for someone that's having epileptic, fit. Okay. So if you've watched up to this extent, I would like you to, subscribe to this channel, like this video. When you like this video, it makes YouTube to push this content so that other people can see it. So you want to help people to see it so that they are more aware of the disease condition and how to care for people with it. So click the like button and of course subscribe and click on the notification bell so that when I post another video, YouTube is going to tell you and you can watch. Now, another thing, let's talk about the myths. Then after the myths, we'll talk about the prevention of epilepsy, and that will be it for today. So the myths that I regularly hear people say is that epilepsy people, if you touch their saliva while they are having a fit, you're going to come down with epilepsy. Now, that is a lie. Epilepsy is not a contagious disease. Contagious diseases are like things like COVID-19. That if you come close, you touch the person, you're going to catch, or Ebola or stuff like that. No, epilepsy is a condition of the brain. It has nothing to do with infection, as in it's not infectious, okay? Like I said, an infection could cause it, but it's not infectious. Like you can't get it by touching someone's saliva or touching someone while the person is having epilepsy or anything like that. No, it's not possible. It's not contagious. So you can give them all the assistance you want to give them. Even if you touch their saliva, you're not going to come down with epilepsy. Now, you don't want to go giving them mouth-to-mouth resuscitation. They actually do not need mouth-to-mouth resuscitation, because provided you lie them to the side, they are fine. They can breathe properly on their own. Then another myth that people say about people with epilepsy is that they can't get pregnant. Of course, they get pregnant and they give birth and all of that. So it's a myth. Well, provided they are on their drugs and the epilepsy is controlled, they can get pregnant. Okay. Now I'm also going to talk about the treatment, lest I forget. So they can actually get pregnant and they'll carry the baby to term and give birth to that baby. Okay, I've seen epileptic people that actually gave birth and they didn't have a seizure or anything while giving birth. Everything was just fine because the epilepsy is under control. Now, the treatment, we have drugs, which is anticonvulsants. So these are things you want to go to the hospital to find out, so that they place you on a drug, because every individual has their own dose. So you cannot borrow your friend's dose and take. No, you have to go let them, and give you the one that works for you. And when you come back for follow-up, they can increase or decrease depending on how you respond to this drug. Now, another thing is surgery, and this is for the focal type of epilepsy. They just go to that part and remove the part that is causing the epilepsy. Or if it's a brain tumor, they will remove the brain tumor and you'll be fine. Another treatment for epilepsy is ketogenic diet. This ketogenic diet has been in existence for a very long time. It's something that people of the olden days have been using to treat epilepsy. So they give them ketogenic diet, which is high fat, high protein, low carb. And this treats the epilepsy or controls it enough that the person could be seizure free. Now, another thing is that epilepsy, you could actually grow out of epilepsy, okay, without treatment. Whereas some people with treatment, regular, routine, daily intake of your drugs, the seizure will stop. And then you also want to assist someone you know who's having epilepsy to remember to take their drug, because that is another thing that happens with people that take drugs on a daily basis. Sometimes they forget to take their drugs, so you want to remind them to take their drugs so that they don't get a fit the next day. Now, let's talk about how to prevent this epilepsy. When it comes to prevention, you want to know how to prevent the this disease like from getting it, or to prevent from getting a fit if you are already epileptic. Now, prevention of this thing is just look at the cause and try to stay away from anything that will cause it. Trauma to the brain, stroke, having stroke. If you have epilepsy, you want to prevent this fit by, there's some things that trigger, like bright lights or flashing of lights could trigger epilepsy for some people, and things like alcohol, okay, could also, taking large quantities of alcohol could trigger the fit. Now, stress, great stress can trigger this fit. Sleeping actually helps calms the fit. Like some people, when they find out that they want to have an epileptic fit, they just go and sleep and they're fine. People with epilepsy, they usually develop this aura, especially if you've had it for a long time. It's kind of like a sensation or a taste in their mouth that will kind of make them know that, hey, something's about to happen. So people that have been epileptic for a long time know when they might be having a fit. So they go sit down or lie down and sleep. Now, when you sleep before an attack, sometimes it makes the whole thing goes away, because sleep kind of calms down the brain, and those excessive firing that would cause epilepsy will just go, or the stress or whatever it is. Once you sleep, you calm down and all of that, so you're fine. Now, another thing we want to talk about is the stigma and discrimination associated with epilepsy. A lot of people find it difficult to marry an epileptic person. It's okay to marry, okay? They're just like any other person that have a chronic disease, okay? It's a chronic disease. It's not infectious or anything like that. So they can operate very well like every other person. Some employers don't give jobs to people with epilepsy. Like if you write that you're epileptic, they won't give a job in Nigeria. But abroad, they give, provided it's a job that, you're safe doing it. Fine, that's fine. But here, they face discrimination here and there. Now, another thing is jokes. People that make jokes out of disease condition. You need to stop that. You're doing like an epileptic person. Oh, see your head like an epileptic person. Oh, see how you're shaking like an epileptic person. Like, stop all those tasteless jokes. They're actually very tasteless. Because now the person you're even telling you're doing, like, you don't even know if the person is epileptic, okay? Or if people around there, if they have relatives or friends that, loved ones that, don't stop saying stuff like that, okay? It's actually a tasteless joke. I hear it a lot. I see people, even comedians, joking about it, and it's not good. And it's not just with epilepsy. Leave all diseases out of your jokes and comedy, okay? Because it's a serious business. It's a serious thing for another person. It's something that keeps people sleepless, and it's not something you want to be cracking jokes about. So if you've watched up to this extent, I would like you to, subscribe to this channel, like this video, and click on the notification bell. Now, if this person falls on the road, okay, you want to bring them out from the road and place them on the ground. If they fall in the pool, carry them out of the water. If they fall anywhere that is not safe, just bring them out from that place. But before going to assist them, please, if it's on a road, make sure you stop the traffic first before one oncoming vehicle will come and, so stop the traffic. Make sure you are safe to be able to save another person. If you don't know how to swim, don't just dive into the pool because you saw someone is having a fit in the pool. You have to, be safe yourself. Make sure you can, bring, or you look for the lifeguard and let them come and rescue this person. So these are some of the things you need to know about how to care for someone with epilepsy. Now, when it comes to driving, if you have uncontrolled epilepsy, you shouldn't drive, because now imagine if you're having a fit while you're driving. That's dangerous both for you and for people around. So until you are certified, free of the seizure, you shouldn't drive. With this, we come to the end of this video. I hope you enjoyed it. Like it if you liked the video actually. Click the like button. Subscribe. Look at the red button down there. Click on it. And click the notification bell so that when I post another video, you're going to be aware. And of course, comment. Say something in the comment section. And I'm going to see you in my next video. Bye.